Okay, so first I'm going to check the orders and check for allergies. I'll assess my patient and assemble my supplies. I'll wash my hands. I'll introduce myself to the patient and identify the patient. Provide for privacy, and then afterwards I will educate the patient, evaluate the patient, and I'll explain the procedures before I do them to the patient. So I have an order for an ice pack to the left ankle, strict bed rest, Foley cath, Norco every 4 hours for pain, and a wet to damp dressing changed to the right thigh. So first I would explain to the patient they're on strict bed rest and not to get up out of the bed without help from anybody. And then I would assess their pain level and go ahead and administer the Norco according to the order. So then I would leave my patient and then come and assess them again in about 30 minutes and to see how, reassess their pain level, and then I would get started on the Foley cath. So first I'm going to put on clean gloves. I'm going to explain to the patient what I'm about to do. So first I'm just going to do pericare, just clean up the area. I'm going to position the patient. Alright. Throw these gloves away. Trash can. And then I'll wash my hands. Now I'm going to set up my sterile field here. Do it down here at the end of the bed. So I'm going to grab this.
Then I'm going to assess my patient and assemble supplies, perform hand hygiene.
Lay this down here with the shiny side down.
Then I would introduce myself to the patient.
And then, so now I can,
Provide for privacy and explain procedures to my
I'm going to put my sterile gloves on. I'm not going to turn my back on my sterile field down there.
So the first thing that I would do.
You did the bed rest first, then the medication, then the Foley.
So I'm checking my doctor's order. I see that he has no allergies. So we have a
Okay.
doctor's order.
So now I've got my sterile gloves on, and I can work in my box down here. And maintain this 1-inch border all the way around. So first I'm going to attach my syringe here to the balloon. Leave that right there. I'm gonna open my lubricant here, and I'll just set it down in the side of the box. Go ahead and take the catheter out. Careful not to let it flop around. Throw this in the trash, and then stick my catheter down in the lubricant. Okay. So now I would open my iodine swabs, set them down in the box too. So now this hand is gonna be my dirty hand, and I'm gonna take out a swab, and I'm gonna clean in a circular motion, starting at the meatus and going down. I'm gonna wipe and then throw away. Do that again in a circular motion, wipe once and then throw it away, and then one more time. And throw it away. And I would not drop my hands below my waist or turn my back to my sterile field. So now I'm ready to insert the catheter. So I would pull the catheter out of the lubricant, tell the patient to bear down, tell them they may feel a little pressure, and insert the catheter. And then I would stop once I got a urine return. And then I'm gonna inflate the balloon. Okay, I would pull back on it to make sure that it's secure. Throw that away. And then I would have a securing device to secure the catheter to the patient's leg so that it doesn't accidentally pull out. Then I would document the how much saline was in the balloon. And I'm gonna hang the bag on the bed frame below the patient's bladder. I would make sure that the patient is tolerating the catheter okay as I'm cleaning up my mess. I would have put clean gloves on for this actually. I'll throw this away. Okay. And then, let's see, I put the patient back in a comfortable position. Wash my hands, of course. Assess the patient's pain level again. And then I'm going to assemble my supplies for the wound dressing. Alright, so I'm going to wash my hands and put clean gloves on, explain to the patient what I'm going to do, and make sure the patient wasn't in any pain first. So then I'm going to pull the old dressing off. I would assess the wound drainage for the color, the odor, amount, and if the dressing needed to be weighed, then that's how I would measure the amount. Okay, so then I'll throw this away. A little trash can down here, and I'll wash my hands. So I'm going to put another pair of clean gloves on. Maybe. Okay. Now I'm gonna assess the actual wound. I'm gonna see, if there's any salt or eschar, or see how it's healing. I'm gonna measure the wound. So to measure the length, there's a little ruler on the back of this in centimeters. I'm not gonna touch the wound with the actual package. So this is about 10 centimeters long. And then to measure the width, I'm going to measure the widest part and it's about 3 centimeters wide.
And this is the doctor's order for an ice pack.
And so now I'm gonna take my little sterile cotton swabs and I'm going to measure the depth. So I'll go to the deepest part and then use the back of this to measure that, and it's about 2 centimeters deep. Throw that away. And I'm going to use my other one to just kind of poke around gently and make sure there's no undermining or tunneling in the wound. Okay, so I'll throw this away. I'm going to take my gloves off, throw them away, and then wash my hands again. Okay, so now I'm ready to do my dressing, clean the wound, do my dressing.
Give them adequate water to take the medication. And then we would assess them 30 minutes later to see if that medication was effective or not. So now we've done that, I'm going to prepare to give this patient a Foley catheter. So we can go ahead and expose the patient.
Alright, now I am going to use my saline here to pour on my gauze. I'm going to go in at the least invasive way, and I'll make sure the saline is in date. I'll put the label in the palm of my hand and just pour some in there. If it was opened before I used it, I would make sure and lip it first, and then I'll make sure to redate it afterwards. So I'm going to put my sterile gloves back on.
So now I'll take off my finger, plug it. And over here I have my sterile equipment and border catheter. So I'm going to grab my little 1-inch border here. I'm going to open that away from me so I don't have to reach over my sterile field. And remember, I'm only touching a 1-inch border around my sterile field so that we don't contaminate it. I'm going to take this.
I've got my sterile gloves on.
My sterile gloves right here.
So
Then I'm going to grab
now
my drape by the
I'm going
very
to
corner of it.
clean my
I'm
wound.
going to try to shake
I'm
it
going to take
well not over my
one of my sterile gauzes with saline on it, and I'm going to clean
This also
from
has a 1-inch border.
the middle first. So I'll clean down the middle once
Sunny side down
and
here.
throw away.
And kind of reach up under, still only grabbing my 1-inch border.
Then I'll clean down each side.
We will not be using this drape either,
Throw
so I'm
away.
gonna go ahead and discard of that. And I'm going to
I'll
throw
clean
my
down this
sterile
side.
gloves. Also, before
Throw
assembling,
away.
or while assembling all this equipment, I'm
Okay, so
gonna
I'm
make sure
done
that
with
the
these. I'm gonna
packages
throw
are
those away
intact
too.
and that it's not expired and it's still within the
So
date.
now I'm going to pack my
These sterile
wound.
gloves also
I'm going
have
to take
a
out my
1-inch border that I
sterile
can
gauze
touch
here and
without
kind of
making
fluff it.
sterile field, so I'm
I
gonna be
use my
really
little
careful.
sterile cotton swab here to kind of poke this down in there. I'll make sure that it doesn't touch the skin.
So with my left hand, I'm gonna grab with my index and thumb like so.
And if this were wet, it would actually stay in
With
there.
my dominant hand, and then with my two first fingers
I'll
on my
throw
dominant
these
hand,
away.
my thumb, kinda go into the
Now,
cuff like that.
put my
Now I have
ABD
my
pad on
sterile
with
gloves
the
on.
blue side up
So I'm free to touch any of this stuff.
on top of the wound. And then, so now the sterile part is over, so now I'm gonna tape it. And I've already got my tape right here.
That I'm gonna do is reach in here and take this plastic off the catheter tip. You can discard that. I have my lubricating jelly here, and I would open this
Two
up and kind of
on
anchor
each
the
end,
base
and then one in the middle.
in here so that it doesn't go flopping around on me everywhere. And you
And then I would initial and date the dressing.
This kit, which I have just opened, actually has no cotton
I'm
swabs.
gonna take these
or,
sterile gloves off
um,
and then throw them away. And then I would wash my hands again,
this is-
check on my
this is like
patient, make sure
iodine,
they're
so I would
tolerating
open
the
my
procedure okay.
Take iodine and squirt it
And
on
then I'm
my
gonna put another pair of
cotton
clean
balls
gloves
there. We can
on
use that to clean the
and
patient.
clean my
I'm
mess
actually gonna
up.
go ahead and attach my syringe so I don't have to work one-handed that way later on.
I'll clean this mess up here. Throw all that away.
Okay, so I have my imaginary cotton balls and
So I'm gonna
forceps, two groups of
take
them.
these gloves
So
off,
I'm
throw them
going to
away,
get
wash
one
my
of cotton
hands.
balls and with this hand, which is now contaminated, I'm going
And now I've come back in the room to do my patient's ice pack. I would assess their pain again and make sure they were okay. Explain to them what I was gonna do. It's gonna be their left ankle is what my order called for.
Now that the patient is clean, I'm not going to
So
give right here.
first I'm gonna put a dry towel under the
Lubricated
patient's ankle. Just like that. And then I'm gonna apply the ice pack. Sometimes these towels may be too thick, so you might have to use a pillowcase or something. So I would do that and put it on the patient's ankle. But if I didn't feel that it was doing enough with the towel, I would put something a little thinner underneath the patient. I'm gonna come in and assess the area every 5 minutes and make sure it's not getting too red or too cold. Make sure the patient's not getting frostbite or that it's not causing too much pain. And then every 20 minutes, I'm gonna remove the ice pack for at least 20 minutes before I put another ice pack back on. So then I'll cover my patient back up, make sure they're comfortable. I'm gonna raise the side rails if there's an order for it. And then put the bed in the lowest position and call it in range.